up, everybody? Dr. Alec here with Dr. Warren. Today, we're going to take a look at him and an injury he's been working through recently. So, how about you get on the table?
Sure, I'd love to.
On your back, please.
So,
and we'll talk while on your back, your other back.
Yeah. I did one of those.
Yeah, you did one of those. Classic. And we're gonna eval his toe today. There's actually not an extensive evaluation process for this, but Dr. Warren, how about you tell us what's been going on with your toe? This is a very history-heavy diagnosis.
And just a little bit of increased activity in the form of attempting to run a marathon with not a ton of training prior. It's kind of a perfect recipe to set this off. And I've had this problem before. Fast, relative pain in my big toe. And then, sprained this ankle probably 15,000 times playing lacrosse and trail running. So I think I've even done some dry needling videos with you before in that area. I'm walking a little funny on this area, and then I was treating patients this week and I was in a lunge position, and I cranked down my foot and my toe in flexion, and I did not do that much more of that the rest of the day because it hurt so much. So I was waiting for a little break in our schedule, and I was waiting to hear. I'll let Dr. Alec take it from there.
Okay, so ladies and gentlemen, what he's essentially describing is what's known as turf toe.
Remember when Todd Heap had turf toe?
I don't know if I do.
Okay, so he's a tight end for the Ravens. He's a Mormon. They don't take medication. They don't do anything from a surgical or injection standpoint, and I just remember it took him a long time to heal from it.
Yeah, I mean, turf toe aptly named after the incidence of this particular injury once they started implementing turf fields in a lot of the professional arenas. What turf toe essentially is either a one-time traumatic dorsiflexion injury of the toe, frankly, it could be a plantar flexion injury as well, or it could come in the form of repetitive stress. So at the end of the day, it is a injury to the capsule around the first metatarsal phalangeal joint. Okay, talk to me about what specifically is hurting you.
More so the top of the foot, I think. Right there in the top portion of the joint, maybe a little bit more.
So are you having pain with extension?
A little bit. If you crank down a little bit more, maybe I could tell you.
Pain with flexion?
That's not that bad.
Okay. What if I tug on her?
Not crazy, man.
You're actually pretty good. Okay.
Yeah.
What if I adduct you?
Starting to feel the sensation there.
Okay. So at this point, I'm just challenging the capsule in a couple different ranges of motion, figuring out what maybe direction he in fact injured it in. Pain or discomfort when I abduct you?
That's the easiest so far.
Easiest one so far. But you feel like if I really gave you some juice?
I'm already, it's starting to kind of turn it up a little bit.
Okay. So that's really consistent with the typical turf toe injury. He doesn't like me really jamming him into dorsiflexion of that big toe. So once again, it's a challenge to the capsule, an irritation to the capsule. I took the shoe off to check for any bruising. If we saw some bruising, we're probably most likely suspecting a grade 2 injury, which at the end of the day, that only changes prognosis. It doesn't change the capability for it to heal. But if I saw a lot of bruising as well, I might consider radiograph how traumatic the incident was to just make sure that the first toe isn't in fact broken, which would kind of clear me to do whatever manual therapy I wanted. So I'm looking at this. There's no bruising, no ecchymosis. He looks really good. I can challenge him in most directions. I know he's been walking. His gait's a little funny. He's afraid to put pressure on his big toe, so he's swinging out a little. He's over supinating just a little when he takes his steps, and I'm just certain that is messing with the rest of his lower extremity chain. In addition to doing a little bit of soft tissue work on your toe, I'm going to adjust your foot, I'm adjusting your ankle, I'm going to adjust your knee, hip, low back. I'm literally going to address the entire kinetic chain on the lower half of your body. And then after that, we are going to do Shockwave, which he's not going to appreciate even 1%.
It'll be intense for sure, but I'll appreciate being better. I don't feel like dealing with this thing, man. I just want to take a moment to appreciate Alec and his ability to deliver a really sound clinical diagnosis. So like if you're a student, I just think that's just such a nice presentation. Him describing the majority of the cases we see as it relates to toe pain, which is going to be that irritation to that capsule there. It was nice to listen to him talk, wasn't it?
I appreciate you. And I tell you what, I snuck a little tool in my pocket because I didn't want you freaking out
this.
Before I even got in the room here. I'm going to use this little doodad, one of Dr. Warren's personal favorite tools, and I'm going to give him a taste of his own medicine.
Yeah, appreciate it though.
Of course. Listen, this isn't crazy. I'm not trying to inflict pain upon him. I just want to stimulate a local inflammatory response. I want to get blood into the area. Joint capsules typically have poor blood supply, just like a ligament or just like the most distal end of a tendon. So I want to do anything I can to stimulate some sort of metabolic activity in that tissue and expedite the growth process. But at the end of the day, that's where the Shockwave device is really going to shine. If I was feeling ambitious, I might even laser this toe too.
Yeah, I would say relative to our protocols with this problem, we have to say to be frank, we can use as many things as we have here to the patient's advantage. We're going to do direct tissue work to it in the form of soft tissue work like he just did. He's going to adjust my ankle, my knee, my hip, my low back. He's going to look at all those areas. And then from a treatment standpoint outside of this room, the Shockwave therapy he talked about, class 4 laser is a really nice addition to the Shockwave. It helps kind of stimulate a good response to that protocol. And then,
I know, buddy.
That was wonderful. What are you talking
Appreciate
about? That
that.
was great. No pain. That felt great. I feel like my toe's better already. That was an awesome adjustment.
I appreciate
So
you.
he's really quick. I definitely I have a preference towards Dr. Alec on his quick adjustments, especially in the extremities. You gotta be fast to get a good cavitation or be a good extremity adjuster. If you don't like treat it a ton, like wrist, ankle, foot, like sometimes you can be a little slow and boggy on a manual therapy in the foot, and Alec is anything but that. Crisp and clean.
Man, I appreciate you.
Yeah, man, you should teach how to people how to adjust. Look, I think you're teaching people right now. Awesome, good. So fib head adjustment there. Doing a little sideline analysis of him working on me while he's working on me.
There it was.
Oh, so there was a mortise joint or talar dome, long axis traction, got a clean cavitation on my ankle. A lot of times what people present with this problem, it's like, wait, why is that capsule getting so irritated? And he talked about it quickly and fluidly. But a lot of times there's stiffness here, there's stiffness or immobility in the anterior hip capsule. They have a hard time getting good extension in the front of their hip, which I actually do have a little bit just because I didn't properly train for this marathon. Paying for it. You know, I'm a sensitive guy, what am I gonna say?
For someone who's as palpatorily inclined as you are to be so sensitive, I can feel your SI joint from the front. Doesn't move that nicely.
Which side?
Right. I would like to manipulate.
Go ahead. Yeah, I'm good.
Are you capable of turning on your side?
Yeah, I'm
Okay.
good for it, man.
I don't want to beat you up in any of these positions.
I might give you the leg a little bit. Yeah, there you go.
Would you like me to adjust you like a pregnant woman today? You got it. It would be a joy. This is one way. If we want to take care with the lower extremity, sometimes we can get, or if there's a pregnant gal out there, this is another way that we can get some motion into an SI joint without necessarily hiking the knee up right into the abdomen like we typically do. Yeah, man. You got that legendary mid back. You tense it up on me, doctor?
I'm right here with you.
I swear, doctors make the worst patients. Dude, you're stiff.
I'm a little tight.
You run a little stiff.
I was born that way, baby.
Tight. Don't you move a muscle.
I know, I'm good for it.
Make sure that SI is moving the way I want. So we move the side that doesn't move.
Yes.
Would it be at all possible just to get your face down super quick?
Oh, a little.
Just super quick. So something we know that suffers when the lower kinetic chain is not functioning properly is the TL junction, the thoracolumbar junction. Because it is a junctional area and the joints are morphologically just slightly different than either the thoracic or lumbar counterparts, what you're going to see is in a person without an injury, without a gait disruption, that's where you're going to see a disproportionate amount of stress, load, or discomfort bore. But someone who is having gait issues, absolutely, his TL junction is going to be a little cranky.
My foot feels amazing right now.
Does it?
Yeah, I feel so good. Thank you.
It's a pleasure. I think you're anticipating me a little here. That's all I want.
Oh, wonderful too.
Just wanted to slide into that TL. Dr. Warner, you good to come up?
Never been better.
Okay.
Let's get some Shockwave.
Yeah, right?
We'll see you there.
There we go. So what Dr. Alec and I were just talking and discussing, so with Shockwave therapy, what is Shockwave therapy, right? It's deep percussion using sound waves. There's different forms of it in terms of how the energy disperses into the tissue. And this form is kind of almost like the hourglass like this. It goes in and out as opposed to divergent forces coming together at a deeper point. So it's good for a lot of different things that we treat in the office. A lot of different things being clinical presentation of knee pain, rotator cuff tendinopathies, frozen shoulder, patellar tendinopathies, jumper's knee. We also see a lot of plantar fasciitis or fasciosis, so stiffening of the plantar fascia. It's good for breaking down scar tissue. And I have capsular repetitive stress. I have this built up adhesion on my capsule of my big toe, like he was describing the room perfectly. And it's a subacute process. It's just recently happened, repetitive stress to it, and there's no bruising, there's no fracture down there. It's just irritation to the soft tissue. Injuries are the most common injuries that are seen, but they're the most poorly treated in the industry, I feel like. A lot of pharmaceuticals, a lot of muscle relaxers, a lot of steroids, right? We need to work tissue, we need to load it, and we need to get it feeling better, and that's what we do here. So Dr. Alec is going to do a great job of treating my toe. He asked me what tip. There's different sensitivities in the body, like we have a tip that treats the jaw for TMD cases, TMJD cases. And then we have for the occiput in the atlas area, that's what it's called. We have tips that treat like the glute tendinopathy, so like people that run a a lot, they get this runner's hip. They get lateral hip pain when they run, or they get sharpness in the lateral portion of the hip. It's usually glute med tendinopathy. It's often described as trochanteric bursitis. There's a deeper tip for that. I requested not that tip because it's intense, and I want to kind of have a little bit of a happy medium. I'm kind of sending it a little bit right now with this one. So if you see me,
Bring your back for me. Nice little pillow. Make your life more comfortable.
that's it right there. We actually should put the clouds in these bright lights. They're brutal.
I actually completely agree.
Oh, it is the one thing to experience your clinic as a patient, isn't it?
It's special.
It is.
Perspective. So, just for the record, on a typical patient, I might even use that really gentle attachment that we use on the jaw or the occiput, but Dr. Warren is a glutton for pain, glutton for punishment, and...
But yeah, well, and I'm going to use a lot of different things in the office to kind of recover from the intensity of this treatment, like laser multiple times. Just got access to it, right? But we might graduate people to this tip after a few sessions and not start off with it right away. So, like a lot of things, there's just like an art to it, and developing that art. Stuff the patient's goals and wants.
Dr. Warren's getting just a little anxious.
Let's talk about something fun. Oh, we are having an office-wide Thanksgiving party. An office giving person.
Yeah, a little discomfort in the top. So here's the deal. I'm going to start Dr. Warren really softly, like half bar. Okay. I'm not going to do more than he's willing to tolerate for about 2,000 pulses. 2,000 pulses is about 90 seconds of treatment, but it feels like 20 minutes when you're in pain. Moral of the story is you want it to be comfortable, relatively.
There, people love this modality. This is just like a really sensitive spot. That's why we're talking about it a lot beforehand.
So I'm going to turn on the compressor. I'm going to give you a little bit of live juice here. I'm going to hit the stop button, and I'm going to take it down.
It's such a sensitive tissue.
So Dr. Warren, I am now on the lowest possible bar.
Good.
I'm at 0.3 bar.
That's wild, yeah. It's very diagnostic. That's actually fine.
Are you okay with that?
It's what I love about this tool so much is like you're gonna roll over different areas, and then you're gonna get to the point of the capsule where I'm feeling the most disturbance, which is right north. Right there, like right there. And you just get to find exactly where, and you can kind of travel around because I'm going to try if I have to get my own stick. You can find exactly where the person's tissue irritation is. It just really, laser focuses in on it. That's not too bad, Alec. I can tolerate that for a session.
Okay. Well, then this is where we'll stay.
Yeah, so what we like to say to people is like a 4 out of 10 intensity. To me, that's probably like a 6, 7 out of 10 intensity. When he gets right there. Wow, what a wild feeling that is. You know what it reminds me of? It reminds me of like when you get dry needle right in the area of like the most sensitive tissue. You know what I mean?
I do know what you mean.
But what's nice about it is like you get a lot of shots that really focus in on that problem area.
Right. So I know the desired effect is happening. I can see a little bit of blanching here, which lets me know that there is blood moving to this tissue.
Yeah.
It's great. Just gonna challenge the capsule right there.
Wow, that's so wild.
So the only thing about the Shockwave is recommended, Dr. Warren, for at least another 6 days. Please don't do anything too ballistic in nature. You're free to exercise, but I don't recommend you trying to set a vertical record. Maybe avoid sprinting, things of that nature. Yeah, it's very superficial, and you're taking it like a champ. I'm impressed.
Oh, thanks, man. Make me feel better about going down below the half bar.
It almost doesn't register on this machine,
Oh,
but
God bless.
home stretch, 290 pulses.
Man, our patients are so much tougher than me.
Everybody is tougher than me. Literally everybody.
Oh man, it's so funny.
Nice.
Yeah, right there is a wild deep ache that I feel through the joint line. And it's like you just hit the injury over and over again. Nicely, thank you.
And that's the full story. Do you have any parting words
Well,
for the
you're
good
gonna
people?
see some quick video of me getting laser. We maybe won't talk as much. We really appreciate you following along. The reason I wanted to do this on camera, one is because it's nice to connect with you guys and to share some of these experiences that we have in here, as well as to recommend it, Shockwave therapy, for maybe some of those problems that you just haven't felt budge with stretching, PT, just chiropractic alone. It's a really awesome modality. There's a reason it's gaining a lot of steam, because when we use it, I'll describe it this way. Like sometimes I'm stuck on a problem, I can't get it better, and I use pain management doctors to help me with it. And a steroid sometimes could be like, whoa, that helped so quickly with something that was being very stubborn. This is giving me the results of like sometimes like a steroid injection will give to certain components without the negative side effects of steroid. So I like it a lot, and for a lot of different reasons, but it has a profound impact on our practice already within a month of gaining it as a modality, and I'm grateful as a patient to have it, and I want you to explore it if you're in the area. I will say this with a caveat: most insurances don't cover it. A few do, but most don't for whatever reason. Blue Cross Blue Shield usually is one that covers a lot of great things, and they don't cover it. Johns Hopkins, a local health insurance plan, covers it. So like you have to check your insurance, see if you have coverage, and then price shop, because there's some clinics out there that charge a crazy amount for it, like north of $300 a session. If you're in Baltimore and you're in Towson, in the area, we start at $70, and we work with people on treatment plans to make it more affordable for them. So definitely something I would recommend in the office, and I do. And if you're in need of something that helps with plantar fasciitis,
Any of these tendinopathies, golfer's elbow, tennis elbow,
chronic stiffness in a joint or tendon, very helpful. Thanks for watching. Check out the laser. And then Alec is going to be doing some videos with me so I can learn from him, which is what I did today, which is awesome. I really appreciate him. He is definitely our clinic lead as it relates to research and education, and he's been leading these weekly clinic sessions with us, and we all love learning from Alec. So thanks, Alec.
Thank you, Dr. Warren.
Yeah.
We'll see you soon.
See you soon.
Is it hot instantly?
It's warm instantly, yeah.
But it doesn't get hot.
And if you stop it, it just got hot, and it gives you a little red sign.
Like, hey, don't do that. Okay, yeah.
It gets pretty warm.
Is it kind of like heating pad vibe after you get your like adjustment and modalities done?
Yeah, a little more deep, a little more focused. It's a different process in terms of how it stimulates the cells. Ooh, that was really warm. But yeah, it's similar to that, what it feels like from a deep heat standpoint and a moist heat pad. We did like a joint continuing education with the Baltimore Orioles and with Johns Hopkins, and it was about the interdependence of the hip and the lower back as it relates to treatment and understanding, like if you got low back pain, look at the hip. If you have hip pain, look at the low back. In essence, Ken Johnson's his name. He's a wonderful physical therapist for Johns Hopkins there, and he runs all their outpatient facilities. Awesome guy, and he's been like a really great source of information for me as a clinician, and he's just stayed so professional and connected with me over the years, and I couldn't say enough nice things about him. But majority of the presentation was actually on tissue repair, when they treat things, what they like to do, combine therapies together, and I got a lot of good exposure to class 4 laser therapy, and he used that in his presentation, and talked a lot about how he uses it as an adjunct at the end of a lot of things to stimulate what he was trying to accomplish, basically. The way I describe it to people that are curious, it's like fertilizer to what we're doing. It's a stimulant, it helps repair, helps challenge the sensation of pain, and as well as get better results. So we use it quite a bit. We use it with the Orioles, now we use it here with patients. We try to create all the good modalities that we use down there in a more of a structured and efficient way to take care of day-to-day problems, real-life problems. Thanks for watching. Hope you guys enjoyed the video with Dr. Alec. We're going to do one on TMD, temporomandibular dysfunction. We love treating that here. We're really passionate about it, and I think we're pretty good at treating it too. So check this video out. I know we did a short one. It was pretty lame. It wasn't like the full thing. So we're going to do a full video talking about it. So if you're interested in learning about it, see how we treat it, or just hopefully get some helpful tips for how you have that problem, you got to subscribe. Oh, first request to subscribe this year. Check out our subscribe button right there.